tell me, what was the problem?
Oh, for 4 or 5 years, low back pain with movement, sitting.
Describe it a little to me.
Pain during the night that would wake you up with movement.
Especially turning from side to
Especially
side?
turning from side to side.
Getting in bed, out of bed?
Getting in bed, out of bed. After standing in one spot for even like 5-10 minutes, just this
What side?
achy on the left. I have difficulty with both, but primarily the left.
And would the pain get worse and better on the side from side to side, or would you just be worse on the left or right side, or how was it, the pain? Sometimes my patient tell me that kind of pain, and you're talking about the sacroiliac pain, that sometimes it's worse on one side for a week and then it gets worse on the other side and it goes back and forth. It can be predominantly worse on one side. Was your pain fluctuating, going up and down on the sides?
It fluctuated, some predominantly left SI, pain, but some on the right prior to the surgery. So yes, flipping back and forth, but definitely more pain on the left.
1 to 10, how bad was that pain?
When it was bad, I would say it was like 8 or 9.
Okay, well,
limited me from so many things.
What did we surgeon, doctors, providers, what did we do for you in that 4 or 5 years?
In that 4 or 5 years, they kept looking at, was my bulging disc that I have causing the trouble, saying to lose weight, and then I shouldn't have pain
And
because there was nothing that was
weight.
causing pain. I have, yes.
So, but it is difficult to lose weight if it's hard to walk.
It was so difficult to do weight loss because movement or walking or even just taking stairs regularly instead of an elevator was just so limiting and painful.
Sometimes we doctors, and this is a confession, we make it easy on ourselves. We tell patient go lose weight and come back, or we say go quit smoking and come back, because we don't want to take on difficult tasks, and and that is unfortunately not unusual that we say patient lose weight or quit smoking, or because it is sometimes hard to take care of.
They're not easy things when you hurt.
Yeah. Now, but how did we finally figure it out what it was?
Through physical therapy and finally being directed to you that, finally someone saying, it's that instability of that SI joint, and I think we can do something. And it was like, yes,
But there is a diagnostic test for that. We injected it, right?
Yep.
Okay. How did the injection go? How many injections did we do, and what was the result of the injection? Do you remember that? That's a long time ago.
Yeah, I believe I had 3 injections, and really didn't get much resolution.
Not the permanent, but we got a temporary improvement.
A very temporary improvement that showed that is where that pain is coming from.
And and that is another thing, that nationwide the diagnostic criteria is actually 2 injections, each of them giving 75% improvement. We sometimes do even 3 injections. As a matter of fact, most of the time we do 3 injections. And as well, some of my patients come and tell me, that injection didn't help, but we put bupivacaine or marcaine, the same thing that the dentist put. So in the gum, because it is well perfused, as you know, it lasts only 4-6 hours, that numbing feeling when they numb up your gum before the dentist start working on you. Sacroiliac joint is not well perfused. It can last up to a day, 2, but the first day or 2 is all what we are looking for. Sometimes we as well put steroid in that can make the effect longer, but sometimes the problem is beyond reach of steroid. How long did those injections last for you?
I would say a couple days.
A couple of days. And that is more than we expect.
Yep.
So, and then we finally did the surgery when?
January 16th of 2019.
So about 9 months or 10 months ago.
Yeah.
Now, how long did you stay in the hospital? Do you remember the surgery?
I remember the surgery. I didn't stay overnight. It was easy procedure. They kept me a few hours afterwards, took me up to the floor. Recovery at home. I was off work for, 4 or 5 weeks,
Mm-hmm.
but not even in much pain, even during the recovery time frame.
We ask you not to put full pressure on that side for a few weeks. How long? And we gave you a walker, right?
Yes, used a walker.
Okay, and that is the one of the reason we don't do both sides at the same time, because if you do it both sides at the same time, you cannot walk. We want you to walk. So how long did you need the walker to walk?
I used the walker probably 4 or 5 weeks.
4 or 5 weeks, okay. And then, how was the pain in that time frame and afterward?
There wasn't a lot of pain
Mm-hmm.
during that time frame, and afterwards, even when gradually starting to put weight on that side, not a significant amount of pain with weight bearing, a little bit with bending, moving,
Mm-hmm.
but it was very tolerable.
Excellent. Now, comparing your symptoms you just described before and after, just how were the symptoms in the first few months and now? After the surgery and now?
Sure. The first few months after the surgery, some achy stiffness with moving, still could tell that there was that area that had been worked on. Now it is like an amazing difference afterwards. I can do stairs, I can walk, I can do normal things outside, go for a walk, go shopping, even get groceries without having pain. And I've been able to move more, which even though I've been focusing on losing weight, some of it has just happened because I've been able to move and function.
Yeah, and that is another thing that we notice as well, that once you are able to move with less pain or pain-free, people now can achieve the goals that they have put in place. Now, having said that, let's look at the quickly that we did in your case, left sacroiliac fusion. As you see here, screws are in the perfect position. You have as well problem on the other side, and you told me as well before the surgery you had problem on the other side. How is the problem on the right side now?
Yes, beforehand, predominantly, I noticed the left so much more than the right, but did have some pain and would say that absolutely the left was more bothersome. But right now, even these 9-10 months after surgery, I rarely notice pain or issues even on the right side.
And that is as well something we frequently hear from our patient, that the pain on the other side gets better. It is the ideal there is that once we fix one side, people can use the side that we fix, in your case the left side, that reduces the stress on the right side. And that is the second reason why we don't do surgery on both sides, because many times when we fix one side, the other side start getting better as well by its own.
And absolutely it has. It's just been amazing. I'm so happy that I had this procedure done.
Thank you so much for the interview. And any other comment or question?
No, you're welcome. And if anybody is having issues, I would certainly recommend seeing Dr. Abbasi and checking it out, because it's made just a tremendous difference in my life.
Thank you so much. I appreciate it.